Hi everyone, today we'll be discussing neurological testing. Neurological testing is a series of tests you can do to examine mental status, coordination and balance, reflexes, among many other things. It basically serves to make sure that your brain and nerves are working properly. For example, at the doctor's office, your doctor may have tapped your knee to see if your leg extends. This is called the patellar reflex and it makes sure your spine is functioning properly. We often want to examine mental status after brain damage, whether that be traumatic damage like being hit in the head, or physiological damage like having a stroke. Damage to the brain can result in something called aphasia. This is caused by damage to parts of the brain that control language. The damage could be due to a stroke where blood flow to the brain is decreased. Brain cells die when they don't receive the normal supply of blood, which carries oxygen and other important nutrients. Other causes of brain injury could be severe blows to the head, brain tumors, or brain infections. One specific type of aphasia is Broca's aphasia, which results from damage to Broca's area. Broca's area is involved in producing language or speaking. Here's a video of someone with Broca's aphasia.
Now tell me what this thing was with your legs last week or week before.
No good. Ache and knees and ankles.
What'd you do about it?
Home, doctor, and legs. Walking, no good.
No good, huh? Man, you're a fellow who likes to walk, too.
Oh,
Yeah,
jeez.
huh?
Oh, boy, oh, boy.
And it's getting too cold
Yeah,
to run your John Deere tractor, isn't
Yeah,
it? Up and
yeah.
downtown.
yeah.
What'd the doctor tell you, Jack?
Don't know.
He doesn't know what's going on,
No.
huh?
No.
Did you feel sick in any other way?
No. No. Ache.
Yeah. Legs ached.
Yeah.
Did you feel weak?
No.
Maybe you had a touch of rheumatiz.
Don't know. But gee.
As you can see, he has trouble producing language or speaking. Is Wernicke's aphasia. Wernicke's aphasia results from damage to Wernicke's area, which is involved in processing language. Now here's a video of someone with Wernicke's aphasia.
Hi Byron, how are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment and talk with the people for them over there. They're diving for them at the moment. They'll save in the moment. He'll have water very soon for him. With luck for him.
So we're on a cruise and we're about to
We
get to
will
Juneau.
store it right here and they'll save their hands right there for them.
And what were we just doing with the iPad?
Right at the moment they don't show a darn thing.
With the iPad that we were doing. Like here?
I'd like my change for me and change hands for me. It would happen. I would talk with Donna sometimes. We're out with them. Other people are working with them. I'm very happy with them.
Good.
This girl was very good and happy. And I play golf and hit other trees. We play out with the hands. We save a lot of hands on hold for us, other hands. I don't know what you get, but I talk with a lot of hand for him. sometime. Am I talk of any more to saying?
All right. Thank you very much.
Thank you very much. I appreciate it, and I hope the world lasts for you.
Thank you. It's been a pleasure. Bye-bye.
Have a good day.
Now let's look at some specific neurological tests. A test for mental status could be a stroke test. There are many different types of stroke tests, but let's look at the NIHSS. This test has 11 categories, and you can get up to 4 points in each category, where 0 is normal function and 4 is severe impairment. Thus, a total score of 0 signals no stroke, and a score of anywhere between 21 to 42 points indicates severe stroke. Here are the 11 categories, and we'll look at some example tests for each category. Level of consciousness tests how alert or responsive a patient is. This could be tested by asking the patient questions like how old they are. Next, horizontal eye movement tests if a patient can move their eyes from left to right, so the doctor may ask you to track a moving pen as he waves it in front of your face. The visual field test tests each eye's vision individually, so the patient may cover one eye and try to read something. The facial palsy test tests for paralysis of the face. For example, the patient could be asked to smile or close their eyes. The motor arm and leg tests see if you can raise your arm and leg or hold it still while your eyes are closed. Here is an example of someone doing the motor arm test.
Up, and then you just hold it there as long as you can. Close your eyes now. Close your eyes, and you just hold that there. You hold it there as long as you can. As long as you can. You hold that there. Hold it as long as you can. 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 You just hold it there as long as you can.
Limb ataxia tests for abnormal limb movements, which can also be tested by having the patient move their limb back and forth. If the movement is regular, then there's no limb ataxia. The sensory test uses a pinprick to see if the patient can feel the pricks on their skin. Language can measure the patient's ability to verbally explain what's happening in a picture, and speech measures exactly how clearly a patient can speak. Lastly, extinction and inattention measures how well the patient can feel touch while their eyes are closed. A doctor would measure extinction of vision by wiggling or holding a finger in front of each eye and seeing if the patient can tell which finger is wiggling. Let's also look at some more specific sensory tests. Light touch, or thigmesthesia, can be used as a screening test for touch. Usually, a doctor will brush different parts of the skin with a Q-tip and ask if you can feel it. Pain can also be used to assess touch. The doctor typically uses a small wooden stick to gently poke the skin. We can also look at temperature by holding a tuning fork to the skin. Since the tuning fork is metal, it's usually perceived as cold or cold to the touch. We can also use a tuning fork to see if a person can feel vibrations. Next, the doctor can test your sense of position, or proprioception. He can do this by bending your finger joint up and down and having you report which way he's bending your finger while your eyes are closed. Another way to test proprioception is by having the patient stand up with their eyes closed. The doctor would gently push the patient and see if the patient loses their balance. If you have poor proprioception, you would struggle maintaining your balance with your eyes closed. We can also examine two-point discrimination by using a paperclip and testing whether the patient can feel two separate pricks or if they perceive it as just one. This tests how accurate the skin's nerves are. Now let's talk about another test for mental status. The most common tool for assessing the severity of a person's Alzheimer's disease is the Mini Mental State Exam, or MMSE. This is also known as the Folstein test. It's a 30-point test used to measure thinking ability or cognition. It measures orientation, time and place. It measures your short-term memory, your attention and ability to solve problems, language, comprehension and motor skills, and some example questions could be, what city, state, and country are we in? or name 3 unrelated objects, or repeat the following no ifs, ands, or buts. And that's it. Thanks for watching this lesson.